Understanding your EOB is one of the most important first steps in understanding how your insurance processed a claim. My name is Gina, and I've worked in the insurance industry for over 20 years with experience in claims, authorizations, and appeals, and health insurance policies and procedures. In this video, we're going to talk about something that confuses a lot of people, the explanation of benefits, often called an EOB. An explanation of benefits is not a bill. That's one of the most important things to remember. The EOB is just a document sent to you by your insurance company. It explains how the claim was processed after the provider submits it to your insurance, okay? It shows the services were billed and how those were evaluated under your insurance plan, how those costs were distributed between the insurance company and the patient. Think of the EOB as a breakdown of the claim decision. Most EOBs include several key pieces of information. You'll likely see the name of the provider who submitted the claim, the date of the service that occurred, the amount the provider billed to the insurance company. You'll see the allowed amount, insurance payment, patient responsibility. So this document is going to give you a lot of good information, and these piece together to explain how that claim is processed under your benefits. Here we see an example of an EOB. And each insurance company EOB can look a little different, but the information is pretty much the same, okay? Claim information, subscriber information, let's see here. Claim information, it's going to have your subscriber, it's going to have your subscriber ID, and it's going to tell you what was billed. So here's your date of service, the provider that billed those services, the amount billed, the allowed amount or contractual amount, your plan paid, so that tells you how much they actually paid. If there's a difference there, that lets you know there's going to be some differences over here, okay? Your other insurance paid. So if you had a primary insurance and this is your secondary, it's going to have your other insurance paid here, your copay, co-insurance, deductible, amount not covered, and what you may owe, okay? And we'll look at another example here in just a sec. All right, here's another example. Again, the same information, claim summary for, and this is going to be the member, the claim number, and this is your date of service. Over here you'll see services provided by, and this is going to be the doctor. This is going to be the insurance and the date it was processed on. And here you'll see it says your total responsibility. Sometimes it'll be down at the bottom and it'll say amount you may owe, okay? Again, these are the services, the dates of service, so they're different dates of service here. Same information, amount paid, amount from other insurance, discounts, copay, deductible, co-insurance. And down here at the end, you'll see claim notes. So two of these claims, it shows that has an S9 claim note. The member's coverage wasn't in effect on the date of service, date the services were provided. So that's very important to know. If you have a denial, it's going to show over here at the end of the claim, and it's going to tell you down here in the claim notes what that looks like, okay? One of the most confusing parts of an EOB is the difference between the amount billed and the allowed amount. So the amount billed is what the provider originally charged for the services. The amount allowed or allowed amount is the amount that your insurance provider or plan, my apologies, your insurance plan recognizes for that service under the contract between the insurance company and the provider. Because of these negotiated rates, the amount billed and the allowed amount are often different. The allowed amount is the number that the insurance company uses to calculate payment and patient responsibility. So if your provider bills $200 and your insurance only allows $150 per the contract for that provider, then the allowed amount is going to be $150. And then they'll apply your benefits on top of that to, if you owe a copay or deductible or something like that. So the EOB will also show a portion that may be the patient's responsibility, as I just stated. This amount can include things like a deductible, co-payments, or co-insurance, depending on your specific insurance plan benefits. For example, part of the cost may be applied toward your deductible, which means that that amount counts towards the deductible requirement of your plan before your insurance begins to cover more of the costs. And understanding how these amounts apply helps explain why you may still receive a bill after insurance processes the claim. Okay? If a claim is denied or partially denied, the EOB will usually include a reason code explaining why. These codes help you to identify whether the issue is related to coverage limitations, missing information, authorization requirements, or administrative processing. Now, the denial reason on the EOB is the first place to look if a claim wasn't processed the way you expected. It provides insights into how the insurance company actually evaluated your claim. Your explanation of benefits is one of the most useful documents when reviewing medical bills. It allows you to compare how the insurance company processed the claim with the bill you receive from the provider. Sometimes differences between these documents can help identify administrative issues or billing questions that may need to be answered. Taking the time to review your EOB can give you a clearer picture of how healthcare costs are processed under your insurance plan. Understanding how explanation of benefit statements work can make a big difference in how you review your healthcare costs. If you want to learn more about insurance claims, medical billing, how healthcare coverage works, you can explore additional education resources at claimsmartsolutions.com. The goal is to help people better understand the claims process so they can review their healthcare information with more clarity and confidence.